Hello, my name is Angela Turvey, and I'm a speech language pathologist at Hillman Pediatric Therapy. Today, I'm going to talk about speech and language skills in ages birth to 5 years and what to be looking for. So let's start by talking about what speech therapy is. Speech therapy is a health profession in which therapists help individuals with the following delays and/or disorders. The first one is the most common one, which are speech sound disorders. So kids who have a hard time articulating their sounds. Fluency disorders are things like stuttering. Resonance disorders would be like a patient who has a cleft palate or is having a hard time with nasal sounds. Receptive language disorders is what the child is understanding. So we always have to make sure a child is understanding language before they're able to use it. And then obviously expressive language disorders, which is what the child is using to communicate. There's also cognitive communication disorders, which would be things like recall, memory, and then there's dysphagia, which is the disorder of the swallow. The last two, I don't personally see that much in my area of work, mostly because I work in a pediatric clinic rather than a hospital. Doesn't mean I can't, but I don't see as many of these types of patients here. So aphasia is the disorder of receptive and expressive language, which usually affects a certain part of the brain due to something like a stroke or a traumatic brain injury. And then dysarthria, same thing. This usually happens from a stroke or traumatic brain injury or a progressive disease like Parkinson's. And dysarthria is a motor disorder. So there's weakness in the articulators like the tongue, lips, jaw, and it makes it slurred and their speech is a little bit slurred. Again, it's not that I can't see them. I just don't see as many stroke patients as I would if I worked in more medical setting or geriatric population. So let's start with birth to 3 and early intervention. Many people and families will ask me, why do we start so early for these kids? And according to the Center on the Developing Child at Harvard University, intervention is likely to be the most effective during the first 3 years of life because the brain is the most flexible or plastic during these years. So I always tell families that a child under the age of 3 is going to learn more than they ever will in their entire life. They are learning everything all at once during these years. And this is helpful because their brain is the most flexible. It is the most able to take all of these skills on at once, where if you or I tried to learn all of these different skills at once, it'd be really difficult for us because our brain has already developed fully. So I always recommend when you go to your pediatrician appointments, especially at that 18-month age, if they say wait and see, I would contact early intervention so that you can get started because the earlier the better. So these are the 6 different areas of language that I assess in the birth to 3 population. I took these from the standardized tool that I use. It's called the Rossetti Infant Toddler Language Scale. So the first area is interaction and attachment. So that is where I'm looking at how the child's interacting with their parents or their caregivers. Do they have strong attachments to them? Do they have stranger danger, but not too much stranger danger? And then the next one would be pragmatics. And this is looking at how a child is using language to socialize. Are they waving? Are they saying hello? Are they playing with some of their peers and taking turns? The next one's gestures, and that's looking at how a child is using gestures to communicate. Are they starting to sign? Are they waving? Are they reaching to be picked up? Are they giving high fives? Number 4 is play, and that's looking at how a child is using language through play. Are they using pretend play? Are they doing some symbolic play? Do they play with their peers? Are they playing alongside their peers? And then language comprehension, which is looking at what the child knows. Do they understand some of those early concepts? Are they able to follow some directions? And this is a really important precursor for then the last one, which is language expression. If a child is not able to comprehend the language, they're not going to be able to use language. But language expression is obviously, are they using words to communicate? What can they say in order to get their wants and needs met? So what should my child be doing? So I took the following charts from the American Speech and Hearing Association, and I won't go through all of them because there's a ton of information here, but I love referring families to ASHA because they have these great charts and a lot of good tips. So we'll start by looking at birth to 1 year, and it breaks it down into hearing and understanding, and then talking. So obviously at birth to 3 months, a child isn't talking, but there still is a lot going on here from a speech and language standpoint. So birth to 3 months, they should be recognizing your voice and quieting if they're crying. They start cooing at this age and they smile at people. 4 to 6 months, they are noticing toys that make sound and paying attention to music. And then they're starting to babble and they continue cooing and make sounds like pa, ba, and ma. And then they are starting to giggle and laugh at this age, which is really fun. 7 months to 1 year is when they start to turn when they call when you call their name. And they start to understand some common words like cup, juice, mom, dad. And then they are babbling longer strings of sound like mimi, baba, up. They are imitating different speech sounds, and right around 1 year is when they say at least 1 to 2 words, and it's usually dog, hi, mom, dad, something very familiar around their home. 1 to 2 years, we start to see a lot more. For hearing and understanding, children should start pointing to a few body parts when you ask, following one-part directions like roll the ball, pointing to pictures in a book when you name them. And then they start using a lot of new words at this time, and they're using sounds like P, B, M, H, and W. And they start to ask questions like, what's that? And they start to put 2 words together, like more apple. One of the most common questions I get is how many words should my child say at each age? So I wanted to throw in there, it's different for a lot of kids and there is a huge range, but the milestone for 2, a child should be using at least 50 different words, at least. That is the milestone. The average is higher than that, but the milestone is 50. 2 to 3 years. For hearing and understanding, a child should be starting to follow 2-part directions and they understand new words very quickly. They have a word for almost everything. They're using sounds like K, G, F, T, D, and N. They're using 2 or 3 words to talk about and ask for things, and they're starting to ask why. And by 3 years of age, a child should be using at least 250 words. So I have a list of strategies that I use in speech therapy. The first one being one of the most common ones I use, and that's sign language. And I included in here that there's studies that show the use of AAC being alternative communication, does not keep a child from talking because a lot of families they think that if we teach them sign, they're just going to sign instead of use words. And that is a myth, as long as there's nothing medical going on, underlying like a disorder of speech. But when we have kiddos who just have those speech delays, the sign language really can help. The next one is choices. So if your child walks over to the fridge because they're hungry, you can pull out 2 foods and ask them, do you want the apple or the banana? And even if they point to the one that they want, that's still communicating. And that's a very important pre-linguistic form of communication. So if a child can't talk, can they point to their wants and needs instead of just grunting and whining? Modeling, pausing, self-talk, which is where you talk about what you're doing. So Miss Jen is building a tower, and then building on that is parallel talk when you talk about what the child is doing. Charlie is touching the birds. Sabotaging the environment. This is when you are going to change up the environment a little bit so that you're providing opportunities for your child to communicate that something's not right here. So one of my favorite things to do in therapy is put things in bins or bags that kids can't open. And then I'll put a toy in it. I'll hand it to the child. And a lot of the families on our first day will say, oh, they don't know how to open that. And I know, but that is my opportunity for the child to say, help, or I don't know. So sabotaging the environment is very important to create those opportunities for language. Holding items up to your face so that they can see how you're making the sounds with your lips. Narrating play, song play, phrase and song completion. I really like to do like ready, set, and then have them complete the phrase for go. Repetitive books and turn-taking activities. So here is a video example. I have my daughter who is 18 months old, and you can see how I use some of these strategies in the video.
Dot, 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 the marker. Dot, 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 the marker. Dot, 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 the marker. This is how we. Dot, dot, dot. All done yellow. Let's get more colors. Oh, you want blue next? Twist, twist, twist. Look. Help. Twist, 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 twist. All done yellow. Do you want green or blue? Oh, blue, please. Let's open the blue marker. Help. Ready? Twist, twist, twist. Pull.
Okay, so going back to the list of strategies, you can see that I gave her a choice of the color. I did a lot of modeling and pausing, waiting for her to talk. I sabotaged the environment by handing her that marker where I knew she couldn't open it so that she had to ask me for help. I did song play and song completion when I was singing the dot song, having her fill in the blank there, and turn taking. So here I have a chart. It's an AAC prompting hierarchy. So again, AAC is augmentative alternative communication. So this can be any sort of alternate communication. So pictures, sign language, or a device. So I like to show families this because if I gave all those strategies to my child and they still didn't answer, as you can see in the video, she did answer, but she wasn't always answering. So this is when I would use this. So at first I would pause, starting at number 1. Then number 2, give an indirect nonverbal prompt. So something I do all the time, and I'm famous for this with my family, is because the kids will go home and copy this, is when I hand them that bag that they can't open and they're trying to open it. I'm giving this indirect nonverbal prompt of putting my finger to my lips and going, so that they know I'm expecting them to say something. The next one would be an indirect verbal prompt. So after I would do that, if they still don't answer, I could say, "What do you want?" Then, and requesting that response from them. You could use a gestural cue too of like maybe tapping the bag to remind them that they have to ask me for help or to open it. Or you can give a partial verbal prompt of "you want," and again, using that phrase completion and pausing. And then if they still don't respond, you would just model it. Help. You can say help. So that covers birth to 3. The next age is 3 to 5 years. And what should my child be doing at these ages? 3 to 4 years, again, these are from ASHA, these charts that I have here. What should my child be able to do between 3 and 4 years? They should be able to compare things with words like bigger and shorter, tell you a story from a book or a video. They start to use more location words like inside, on, and under. They recognize signs and logos like stop. We definitely do a lot more of the intelligibility here because we're expecting more intelligibility at this age. So by 3, your child should be at least 75% intelligible to an unfamiliar listener. And then by 4, they should be 100% intelligible. So they should be correctly producing sounds like T, K, G, F, Y, and ING words. They're saying all the syllables in a word at this age. They're talking smoothly. They're not repeating sounds, words, or phrases. And then they might mistake some sounds that develop a little bit later, like L, J, R, S, H, C, H, S, V, and Z. And then also some blended sounds, they're called consonant clusters. So they should be producing the TW in tweet. What can I do to help? So you can cut out some pictures from old magazines and make silly pictures by gluing all the parts together in different areas. Again, this is kind of like sabotaging the environment so that they're talking about what's silly and why they don't go together. Sorting pictures and objects into categories like foods, animals, and shapes. Read, sing, and talk about what you're doing and where you're going, and start using those rhyming words with them to help them learn the new words and sentences. Read books with a simple story and talk about the story with your child. Help them retell the story or act it out. And then act out some daily activities like cooking, food, or going to the doctor, and really talk about all of those things that are happening within each daily activity. 4 to 5 years. Your child should be producing grammatically correct sentences, sentences that are longer and more complex. They should be including main characters, settings, and words. They're using at least one irregular plural form like feet or men. They are imitating reading and writing from left and right, and then blending word parts like cup and cake to make cupcake. And they're starting to identify some rhyming words like cat and hat. What can I do to help? Again, you can use some of those things from 3 to 4 years, but you can also start talking about where things are in space and using words like first and last or right and left. Pay attention when your child speaks, respond, praise, and encourage them when they talk, and get their attention before you speak. So pause after speaking and let them respond to what you said to establish those conversational skills. Keep teaching your child new words and define words to help them understand them, but also teach them to ask for help when they don't understand those words. Point out objects that may be the same or different. Play some games like I Spy to describe the things you see. Okay, so that covers birth to 5 years for speech and language, but I also wanted to talk a little bit about feeding. A lot of people don't know that speech language pathologists can work on feeding. And so I'm going to define some of the areas that we work on. So a lot of kids can be picky eaters, but there's a difference between picky eaters and problem feeders. So picky eaters are when they have a decreased food repertoire that has at least 30 foods, but they can tolerate new foods on their plate. Problem eaters are where kids are eating a very restricted diet of less than 20 foods, and it is affecting their day-to-day interaction with foods. These kids will cry, scream, tantrum when new foods are introduced. Swallowing disorders. So that's, again, that dysphagia that I talked about early on. And dysphagia is basically difficulty swallowing. And there's aspiration that comes with dysphagia. And aspiration is where the food or liquid enters the lungs when you're eating, which can be very dangerous because it can cause aspiration pneumonia. Again, we see this a lot in the geriatric population, but we also do see it in pediatrics too, especially with kiddos who have medical disorders. So some symptoms of aspiration are coughing, choking, watery eyes, wet and gurgly voice, and wheezing. If you notice any of these symptoms, you should always refer families to a speech language pathologist that can conduct a video fluoroscopic swallow study, which is basically an X-ray of the swallow, so they can see exactly what's happening with the food in all the phases of the swallow and see if they are aspirating or not. Here I have a link, again, from ASHA. It has a handful of videos that show you some signs of picky eating and what to look for, what to expect with some strategies. I won't go into them, but a really good link for you guys to see. Some picky eater strategies. So establishing good mealtime routines like washing your hands before you eat, letting the kids help with mealtime preparation, making it a fun cooking experience together. Mealtime environment, so sitting at the table as a family, which I know is really hard sometimes, but trying to do that and giving them proper positioning. So an ideal position for eating is 90, 90, 90. You want their head at 90 degrees, their body at 90 degrees, and their legs and feet at 90 degrees. which is important for stability and using the correct muscles when you're eating and when you're chewing. I've come to learn that a lot of high chairs don't have the greatest positioning, so I do a lot of adapting with, pool noodles, towels, and rolling them up just to make sure kids are sitting at the best positioning that they can. Offering foods that you eat. I know that there's toddler foods, but the more we offer those toddler foods like mac and cheese, chicken nuggets, they're going to prefer those foods over the foods we're eating, mostly because they're all the same. They don't change. So it's important, unless you guys as a family are eating those toddler foods too, to offer exactly what you're eating so everybody's eating the same exact thing. Offer preferred and non-preferred foods together. So remembering to offer some new foods on their plate, even if they don't eat them, so that they just can be exposed to them. Trying not to say, eat this, because the more we put that demand on a child, the more we are going to be getting in this toddler argument by putting that demand on them. So it's important, instead of saying, eat this, maybe you're engaging in some messy food play with it, so that they can put a car through the mashed potatoes or something like that, so that they don't have that demand of eating. Or another good example I'm sure everyone's heard of is like making that mashed potato volcano and using the broccoli as trees and doing that instead, so that they can eat it when they are ready to eat it. Okay. So in summary, if you see any children with any of these signs of symptoms of speech, language, or feeding, please refer to a speech language pathologist, and you can contact us at Hillman Pediatric Therapy. The number here is 815-773-9000. And here's my references. Thank you.